Hi, and welcome to the show. Rate and review at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today on the show, we have Jacques Balayla. He's an obstetrics gynecology physician. His Kevin MD article is titled Batman Catching Babies. Jacques, welcome to the show.
Thank you so much, Dr. Poe. How are you?
Good. We'll get to the article in a little bit. First off, briefly share your story and journey to where you are today.
Certainly. I am actually currently based out of Montreal, Canada. I am actually born in Venezuela, though I immigrated to Canada back in 2002. Medicine was not really something that I ever envisioned, but unfortunately my mother got sick and I was sort of thrown into this sort of caregiving role that I was not necessarily ready for nor was expecting, but ultimately fell in love with. The person behind that caregiving role being my mother, it really solidified the notions about the role of the woman in the family and in society. And it made me sort of really fall in love with the field of women's health in general. And I decided then to pursue my studies in medicine, in academic medicine at that. Ended up going through medical school here at McGill University and then graduated as an OBGYN. I have a master's degree in public health as well. And I am currently a clinical investigator at the Lady Davis Institute here at the Jewish General Hospital in Montreal.
All right. So tell me about some of the challenges today practicing obstetrics gynecology in Canada.
So some of the challenges, in fact, that we faced quite recently, in fact, were related primarily to the pandemic. As you know, pregnant women, for example, are somewhat immunosuppressed during pregnancy, and they are slightly higher risk of getting severe COVID. So we certainly had several admissions in the ICU, several really difficult cases in terms of management, multidisciplinary management in pregnant patients, caring both for mother and baby, obviously. So that was certainly a new challenge that we had to sort of adapt to very quickly. And more generally, though, in Canada, because we have socialized healthcare, access to care is somewhat easier. And public health is actually quite present in our country. We had to do a lot of telemedicine, speaking to patients over the phone and doing sort of online consultations. And as you can imagine, for an obstetrician gynecologist who needs sometimes to examine areas that are a bit more private, it's impossible to do, obviously, online. And so sometimes you have to sort of weigh the risk of bringing a patient into the clinic to be able to examine them, seeing in person, with the risk of them getting COVID, particularly if they're pregnant. So that was a challenge that we had to adapt to, and which ultimately, slowly as we sort of teeter out the pandemic, are only sort of realizing now that, like, wow, that was really quite an experience that we had as obstetrician gynecologists.
Now, for those medical students who may be listening to you on this podcast,
yeah,
what are some reasons they should consider obstetrics gynecology as a career?
My answer for this is always the same, and it's actually quite related to the article that we'll talk about in a moment. It is that in a world that otherwise seems so ugly, so sad, so stressful sometimes, so hyperactive in many respects, the one guaranteed grain of beauty that you can always count on is a new baby coming into the world. It is an extremely fulfilling practice and career. And yes, it comes with its challenges, certainly in terms of scheduling, in terms of training, but the payout, I think, even on a human and a personal level, are so tremendous that anybody that's even remotely curious about that experience, I encourage them to at least try to have an elective as a medical student in obstetrics. Really enjoy your clerkship, your medical school years, because it is a very special specialty, unlike many others, to the degree that I can tell you how, think of it like this: how many doctors can say that most of their patients aren't? Even family physicians, general practitioners that do primary care will oftentimes see complications probably at rates higher than obstetricians would. And that's not to say that things cannot go bad in pregnancy. Obviously they can. But as a general rule, it's such a joy to work with this population that, particularly in times of societal difficulties like we're living through at the moment, it puts such a sharp contrast between sort of what is really real and raw and valuable and virtuous and the noise, that we create as a society with changing times and increasing challenges. So that to me is really the reason why I went into obstetrics. Obviously, my mother played a big role in sort of being the female lead in the family, the nuclear family, and that was inspiring to me personally. But I encourage everybody to at least sort of dip your fingers into it. I guarantee you'll fall in love.
All right, let's talk about your Kevin MD article.
Yeah.
Batman Catching Babies. Now, give us a sense. Why'd you write this article?
Yeah. So it doesn't come as a surprise that a lot of the times when we have sort of deeper thoughts in our lives are times where we don't necessarily expect it. You could be in the shower, you could be driving, you could be sometimes, like in my case, awake at 3 o'clock in the morning about to deliver a baby, and sort of these thoughts come into your head about the things that you're living at the moment. And for me, it was a huge realization. It was a night about probably 6-7 months ago where a baby was being born It was probably that 3 o'clock in the morning. And I'm thinking to myself, what am I doing here at 3 a.m.? Like, how did life sort of bring me to a position, to a place where I can actually make a difference in this person's life and create memories that they'll literally cherish for the rest of their lives. And I felt very privileged. I felt very emotional. I felt very humbled. I felt very inspired. And doing one of the realizations that I got, not that day, but essentially it's been a realization that I've had really throughout my studies is, when you scan a mother and you see the baby looks similar to any other baby that you've scanned, you're looking for the same organs, you're looking for the same sort of features, the same anatomical landmarks. And then somehow you see them after birth and they look entirely different. It's really reinforced the idea that there's some kind of common denominator amongst all of us, and that it puts then into perspective all of the challenges that we're facing, all of the sectarian partisanship, not only politically, but even from a religious perspective or social perspective. Probably, again, more of that noise I was talking about than the actual reality. I think we have more in common with one another than we let on. And I think if we were really cognizant of this fact, I think we'd be much better providers, sort of as a general community, and we would probably have less backlash than we often get, especially in times of controversy, like things like COVID, for example, that really brought about a lot of the skepticism, I guess, out of individuals into more of a public forum.
Now, even in Canada, there's so many obstacles, right, that interferes between that doctor-patient relationship. Now,
absolutely,
you have a very idealized notion of obstetrics gynecology, and
that is true.
I love hearing that. I love hearing that. So I guess the question is, how do you maintain that focus when there's this, like you said, so much noise around you, so much bureaucracy, so much interference between that doctor and patient? How do you maintain that idealized notion?
You're absolutely correct. And you're right that this was a single event that sort of inspired me to write the article, but that there are times essentially where you do ask yourself questions and you tell yourself, well, is this worth all of the sweat and the sleepless nights, all the bureaucracy, the difficulty with insurance, the difficulty, for example, accessing care, the times where, rare as they may be, are catastrophic for a pregnant woman or her baby. We're talking about in the US now, that removing a woman's ability to choose over her own sort of autonomy. These are things that essentially shake you, and that could very well, if you're not, conscious of the fact, change your mindset about what it is that you do, why it is that you went into it in the first place. Because for me, I think it was such a personal reason, and I have very fond, obviously, memories of my mother who's passed on now. She's really what keeps my life going. I also happen to be a father, and I have kids, and I sort of look at them, and I can only imagine the joy that other parents are feeling when they look at their own kids. And that motivates me to try to provide the best care and making sure the experience that at least couples can have, to the degree that the biology allows it, is a good one. And that is really my main source of motivation. But I hear what you're saying, and this is in fact an issue. I cannot tell you how many colleagues of mine are either burnout or on the way to being burnt out. And I don't blame them, because the world can be so overwhelming that you can lose sometimes sight of about why you're doing what it is that you're doing in the first place. And it's tricky because it can be quite inconspicuous. It can just come on at any point.
And when you hear these stories from your colleagues, and I'm sure in Canada and the States, burnout is a common topic or an increasingly frequent topic. What goes through your mind when you hear your colleagues talking about burnout?
It saddens me, because my colleagues are phenomenal human beings. And I know that the desire that they have, it is to help, it is to be of service, it is to make sure that, at least in not only in obstetrics and gynecology, but I think generally speaking, in all of medicine, is to do well by your patients. I think we all sort of swear an oath to that. And so it saddens me that there are factors outside of that relationship between the patient and the physician that sometimes interfere. And it saddens me even more when those misconceptions or those difficulties arise as a consequence of some kind of controversial notion, or some kind of the poor messaging from behalf of a public health agency, for example, during COVID, or some kind of government entity that comes out and says, and then all of a sudden, because somebody else said something about a vaccine and you represent the medical system, then all of a sudden you're the enemy and not an ally anymore. And for me, it's really sad, but I understand. I understand because I've been on the receiving end of that criticism at times as well. And it isn't fun. And when you don't have
give us an example of that, from patients, from
for example,
from politicians. Give us the example.
I'll give you the perfect example. Right now, the government, at least here where I live, is trying to bring back some kind of normalcy to our lives. And obviously we appreciate that as a society, but a lot of people are still, I think, reasonably and rationally concerned about the risk of COVID. There are new variants that are coming on, and then the winter months are coming as well. But the government, for example, is discouraging physicians from entertaining consultations again at a distance, online, telemedicine, which were actually of big help, because it's true that while some patients do need to be seen in person, there are many things that we can fix at a distance. There are many things that we can do for them, even if they're at a distance, that the government is now trying to discourage us from doing. And what ends up actually translating clinically is that the patient then maybe won't show up. And that barrier to care should not be there, or at least in my view, there's no valid reason why it should be there. It makes difficulties for us to be able to access, the care for the patient that they need. And then obviously, understandably, I think the patient may be upset or underwhelmed with the care that they have received, and not understanding that it's not that we want to put them at risk, but there's sometimes protocols in place that we ourselves are bound by. And so we don't have always the control of that sort of patient-physician relationship, and neither does the patient. And so all of a sudden, you start entering into third parties. And I know that, for example, in the US, this is an issue with, insurance companies, government, hospital boards, even local governments, where the decisions for, in particularly women, are being taken out of that sort of the confines of the clinical encounter.
Now, if you were to redo your entire medical career again, is there anything that you would do differently?
I don't think so. I think for all the difficulties that I may have lived in my personal life, and all the challenges that residency in obstetrics and gynecology and being an attending in medicine, generally speaking, bring, it's still been a solidly positive experience, an experience that I wish other people would have the privilege to experience, assuming that it's something that interests them and it's their passion. I would tell you that some of the things that I've learned, however, that I wish I would have perhaps applied sooner. Some of the things that essentially even during the pandemic became a lot more important for me was the fact of just sometimes listening, the power of the spoken word. We live in 2022. We have all these fancy tools and all these diagnostic, technologies that allows us to treat and to really heal beyond anything we've ever done before. And that's fantastic. But there's still a human side to medicine that I think we've sometimes shy away from. And one of the things that I wish I had been, inculcated in me was the notion of that communication and how actually critical it is. I always give the example of sometimes I can have somebody break down in front of me because of something that I said. I haven't done anything. I haven't said anything. I told somebody, your test is normal, or talk to me about how you're feeling. How is this pandemic affecting you? It's scary, to have a baby during a pandemic where you're not necessarily sure what the world holds and in what world you're bringing your baby into. And sometimes just listening, it makes such a big difference, more so than I had ever hoped. You always assume that you're somebody that coming to for a service that you are providing, and then, on to the next. And I think that the nature of medicine is, as much as it is scientific, it's also an art. And there's the human side that I think if we were to exploit a little bit more, if we were to explore is the right word, I think it would do us a lot of good.
And my final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
Yeah. So I think that relates a little bit to your question before. To me, one of the take-home messages is that, passion is important, but passions need to be fed. Passions need to be sustained and maintained. Passion is not something that you develop once and eventually you just assume that it doesn't fade, because it can sometimes fade. And sometimes that passion, sort of that light that sometimes dwindles, it's not necessarily because of your own doing, like we were saying. Sometimes there are external agents and external factors. But diversifying your scope of practice, understanding what it is that makes you tick, pursuing that, and sort of keeping the perspective of why it is that you're doing what you're doing without necessarily listening to that noise, is what I would recommend, even not only current colleagues, and I try to do that as often as I can, but also incoming students who will have a whole host of potential disciplines that they can choose from, but they hear things, or they're scared, or they love something, but they've been told that the lifestyle is not great, or that, you're a woman, how are you going to get married and have babies if you're a surgeon? Or why do you want to see people with mental illness all day? You're going to get tired. And all of these nonsensical things that at the end of the day say nothing about how you feel about a certain discipline or a certain specialty. And so my advice would be also to follow your passion, but to keep on feeding your passion, because passions sometimes do fade. And again, that is not necessarily a consequence of your own behavior or your own thoughts, but sometimes it can be from external factors.
Jacques, thank you so much for sharing your time and insight, and thanks again for being on the show.
My pleasure, Dr. Bo. Thank you so much.